Our MEDEX physician advisors, these are a network of about 70, 72 doctors that we work with in various countries around the world. These are our major contacts for information on the level of care in an individual country. We have more than 36 specialties and subspecialties represented. We have more than 35 languages represented among these doctors. And we tend to use them either for their specialties or for their languages. And sometimes we'll use a specialist in conjunction with someone who is an expert in a particular region. So sometimes we use two doctors together to comment on a particular case. We credential them every 2 years. They tend to be board certified, experts in evacuation process, 24-hour availability. Now, we work with air ambulance companies around the world. We have about 120 air ambulance companies that we deal with in various countries around the world. And we divide these up in the same way that we divide up the centers of excellence into international versus regional. The international ones can do the long-haul transfers, and the regional ones can do just in the immediate area. So for example, if you have someone in Kazakhstan or Uzbekistan, we would use one of the long-haul providers to send them to Helsinki, for example, or Vienna, something like that. We would use a regional air ambulance provider, for instance, if someone were in Sudan and needed to go to Nairobi for better care. We might use a regional air ambulance. So that's basically the difference. In credentialing these air ambulances, we look at things like the equipment, we look at the insurance, and that's insurance both for the aircraft and also for the individual physicians who work for that company. We look at how long they've been in the business. And oftentimes you'll find in the air ambulance business that there are a lot of providers that have just been around for a few years, and it's basically someone who owns a plane and knows a doctor. So, I mean, you know, there are a lot of very sort of not very reliable people in the business. We tend to work with people that have a great deal of experience in transporting our patients, because obviously that's very important. And we re-credential them every few years. We look at their ongoing education for their crew members. We look at the licensing for their doctors and make sure it's kept up to date. And we look at the maintenance record for the planes and make sure that that's kept up to date as well. Now, this is just a map showing you where our centers of excellence are located. And as you can see, they're pretty much all around the globe in major cities. You know, for these areas here, where there's a lot of space, frankly, there aren't very many really good facilities that we would normally evacuate to. So we tend to, if people are in this location, for instance, we tend to go up or down, basically to Johannesburg or to Rome. We do use facilities sometimes in Nairobi, as I mentioned before, for immediately surrounding locations. And up here as well, you see there's a great expanse of green. From Kazakhstan, for example, we might evacuate to Western Europe. And from this area up here, we might evacuate to Hong Kong or Singapore, for example. These are the physician advisors that we have. And I mentioned before, we have a few of them that are right in Baltimore. We have all over the world, basically, especially in Europe. We have a few in Africa and in Asia. So really, they're all over the world as well. And they comment on the individual levels of care in their country and in their region. And these are the air ambulance companies that we use. As you can see, we have a lot in the U.S., but we also have all over the world, basically. And as I mentioned before, from this area, we would evac here, from this area down here, and these areas here, and then up or down. Now, one other thing I wanted to mention about these spaces is that we do have hospitals there that we work with. They're the best available locally. They might not always be ones that you want to keep a patient in long term, but they can at least stabilize the patient until we get them out. So, you know, if we showed you all of our resources, basically, it would cover the entire globe. This just gives you an idea of the best resources that we have that we use most frequently. And, you know, if necessary, we will get patients out to those to those resources if they're in a location with a lesser level of care. And we also have an online tool that's called MEDEX 360. And basically what that is, it provides information on various countries, health information, information on how to access emergency care, for example, in various countries. A lot of people think that you dial 911 and you can do the same thing overseas, but frankly, it's very different depending on what country you're in. I mean, sometimes you dial 112, for example, in Europe. In other countries, there's just no such thing as an emergency number, and you just have to dial the hospital. So, I mean, that's something we keep in mind as well. We often advise people in certain countries that you should not take an ambulance, that you should go with a taxi or a private car, because the ambulances are such poor quality that it's not worth calling them. We have information on paying for health care, on vaccinations, on immunizations, and details of prevalent diseases in certain countries. For instance, Japanese encephalitis or Asian flu that's prevalent in certain countries. We also have, for instance, translation of medical phrases that are useful if someone's going to a hospital. And we have the equivalents of various drugs. So, for instance, if someone is looking for the equivalent of an antibiotic and they're in China, we have the names of the equivalents, and that's all on the website. And this is just an example of the China page we have on MEDEX 360. And as you can see, it has some current alerts that are going on for hand, foot, mouth disease, for infant formula-related illness, which I think you've all read about, the melamine issue, and quality of care, language proficiency, and various other things that I talked about already over there. So it's a really, really good tool for people who are planning a trip overseas and need some kind of medical information. Just briefly, I went on a trip to China in advance of the Olympics. I visited all 6 Olympic cities on the mainland, because Hong Kong was included as well, but we didn't go there. And basically looked at the different hospitals that our clients might be using, and this is partly a result of that. This also includes some other information on just basic things you need to know before you go to China, security information, that kind of thing, drug translations, as we said before. And the actual webinar that we did after the visit to China is available on our website. So anyone that's interested, please take a look. And right now, I'm going to pass it back to Bruce, who will introduce Tom.
Okay, thanks.
Thank you.